Placebo Effect by Brie Glazer and Ryan Luttrell.
So what the placebo effect is the placebo effect is when someone's mind convinces the body that something is like happening. So an example of this would be when you give somebody a pill and you say that it's something like melatonin and it's actually not, and their brain convinces them that they're taking melatonin and it causes an effect. We chose this topic because we found it super interesting and we really wanted to test how well it would work. We thought that it was something that you wouldn't be able to manipulate or change as easy as it claims it is. And we thought that depending on the person, their mind might not fall for a trick like this.
John Haygarth was the first person to test this, and in the left-hand corner, it's a picture of him. And then we have a video explaining what he did.
The placebo effect has been known for hundreds of years, but only now we are beginning to understand how it works. The first scientific work involving a placebo was in 1799 when Dr. John Haygarth tested a medical device known as Perkins tractors. This was a quack treatment where metal rods were pressed on the patient's skin to draw out disease by means of magic. Haygarth trialled this against a similar treatment with non-magical wooden rods and found that patients responded just as well to this dummy treatment. Rather than seeing the patients as frauds, he understood that offering hope to them was beneficial in of itself. Haygarth attributed the success of placebo treatment to the imagination. Our modern understanding of placebo has hardly changed until recently. These days, the main use of placebos is as a control in clinical trials. Until recently, we never really focused on the mechanisms of this phenomenon or how we could manipulate it. Recent research has begun to unravel the mystery. In the late 70s, dentists experimented on a group of patients who were having a tooth removed. They wanted to test whether the placebo's effect on pain relief were caused by the body's endorphin system, which is its natural opiate system. The patients were given typical painkillers during their surgery, but a few hours later, as the treatment was wearing off, the dentist gave the patients another dose. Half were given a placebo, and the others were given naloxone. You may have heard of naloxone. It is most commonly used to revive people under an opiate overdose by bonding the same chemical sites in the body, nullifying their effects.
So some of what we found in our research, so we found that these effects of the placebo effect are most successful in tests when it deals with pain and discomfort. So things such as like pain relievers and a lot of medical industry things such as like dentist offices and medical clinics and things like that when you use something like pain reliever or drugs that help to numb pain. We also learned that part of the reason the placebo effect isn't super well used is because a lot of people don't know about it, and a lot of people don't know how it affects the brain and how it neurologically affects you. We also learned that 35% of people say that they felt symptom relief when they took the placebo. This just helps to show that when the placebo is done correct and you actually make it unknown that the placebo that you're giving them is not what you say it is, then the brain and their imagination will help to make it feel and have the effects of what the actual drug or medicine or whatever you're testing it will.
So what we did in our experiment was we got 3 people and had them take melatonin, and then we gave the person a vitamin who was taking the placebo, and then we gave someone nothing. And then we had them go to bed at night, and then when they woke up, they would report when they went to bed and when they got up, and if the melatonin worked.
So this is our video on how we conducted our experiment and what we did.
Alright, you two are getting melatonin. You're not getting anything. Make sure that when you guys go to sleep and wake up, you know when you went to bed and when you woke up. What time did you go to bed? What time did you wake up? And how long did you sleep?
I went to bed about 11. woke up at 9, about 10 hours.
I went to sleep at 10:45, woke up at 9:45, it's 11 hours.
I went to bed at midnight. I got up at 7:30. So I got 7.5 hours of sleep.
Did the melatonin help you sleep better than normal?
Yeah, I think so. Felt like it did.
Yes, I was exhausted right after.
I didn't get crap.
So as you can tell in this video, the person in the middle was our person that we gave the placebo to. He thought that he took melatonin, and he noticed that he felt really exhausted after taking what was thought to be melatonin. And it just proved that his brain thought that he was taking melatonin and tricked himself into falling asleep faster and getting better sleep than he normally did, just because he thought he was taking melatonin, which most people think and know as a medicine that helps you sleep better and go to sleep faster, where in reality he got a vitamin.
So from our field day, we found the placebo effect does work when someone believes that they're getting the actual pill. Our test subject said that he felt more tired and slept way better after taking the melatonin. And then he had no idea that he was even taking it, and he ended up tricking himself into thinking that he did.
Our closing thoughts. So we found that this experiment really works, and that it was super easy to do, and that it would work with friends or people that you tried it on, but it is an experiment that you can do with a lot of different placebos that would work very efficiently. We also found that it's super easy to conduct, and that it's an experiment that anybody at home or in a medical environment or any kind of environment could do. It doesn't require a lot of resources. All it requires is having somebody that doesn't know what they're taking or signing up for and tricking them. It's also very interesting to see how much they react when getting a pill that's not real, and how much their brain makes it feel like it's real and gives them real effects of something like this. Like we used in our melatonin, we gave him a vitamin, and he changed how he slept drastically, even though he got something that wasn't anywhere near the real pill. We also found it was super interesting to see that your mind would help mess with this, using your imagination and trying to kind of using your imagination to change the pill from something that it's not to something that you think it is.
And then these are our references.